Hello all, and welcome to our webinar on post-traumatic stress disorder in practitioners and patients. I am Dr. Joanne Yanez, and we will be starting in about 2 minutes, so hang tight and thank you for joining. All, we're at the top of the hour, wherever you're calling from. Thank you for joining us. I am Dr. Joanne Yanez. I'm the Executive Director for the Association of Accredited Naturopathic Medical Colleges. And we're going to be talking today about post-traumatic stress in practitioners and patients. This was quickly pulled together by Doctors Radley, Ramdhan, and Teri Davis in light of the current climate, the social unrest, the racial tension, racial inequities, LGBTQ plus inequities that we've been seeing on a daily basis. And I wanted to reach out to our community of practitioners and students and patients and potential prospective students as well, just in light of everything that's going on, and create a safe and healing space for us for the next hour with the graciousness of these two docs who have worked way more than I have on this topic. And so before we get started, I do want to just give a little bit of housekeeping. So this webinar will be recorded. If you've registered, we will send out a recording most likely tomorrow, barring all technology snafus. And I just very much welcome you all and thank you for joining. And I hope that you all get something meaningful out of today. We will have a question and answer box, so if there are any questions that you may have, please enter it into the Q&A, not the chat. And other than that, welcome and thank you. And so with that, I'm going to introduce our speakers. Dr. Teri Davis is a naturopathic physician and certified mindfulness-based stress reduction instructor in practice since 1978. Dr. Davis teaches MBSR classes in her community at the Tucson Veterans Center, the Tucson VA Hospital. She's the founder of the Mindfulness Veterans Project and teaches these skills to help mobilize internal strengths and external resources for growth and healing for veterans, service members, and their families at no charge. She's a graduate of the National University of Natural Medicine. Dr. Radley Ramdhan earned his Master of Science in Acupuncture and Doctor of Naturopathic Medicine at the University of Bridgeport. While pursuing his studies, he served as a specialist in the United States Army Corps of Engineers, New York Army National Guard for 6 years. It was through his military experience that he developed special interest in working with PTSD, and as a result completed his thesis on understanding and treating this with naturopathic medicine. He served one deployment in Operation Inherent Resolve in Kuwait and Iraq. And so on behalf of AANMC and all of our member schools, I sincerely thank you both for joining us today. And I will turn this over to you both. And they're going to tag team, so you're going to hear both of their voices throughout the course of the webinar today.
Great, thank you very much.
Dr. Ramdhan, we're not able to hear you if you're speaking.
Sorry about that. Good night to everyone, and thank you guys for taking the time out to join us for this very interesting topic. So I'm going to start with a quick definition of what trauma is from the National Institute of Mental Health. Trauma is classified as a stressful or negative experience. This includes physical or sexual abuse, neglect, emotional abuse, poverty, witnessing distressing events like family or community violence. So there's different types of traumas. There's acute trauma, chronic, and complex. The acute trauma deals with a single event. Chronic deals with repetitive and prolonged exposure to trauma, and complex involves varied and multiple traumatic events. With trauma, there's something called transgenerational trauma. And this is just basically how trauma passes on from one generation to another. So with one generation, there's typically a survivor. The first generation that survives the trauma, they go into 4 categories of styles that they adopt to sort of carry themselves through. So there's the victim, there's the ones that become numb, there's the fighters, and there's those who made it. The victim has a difficulty moving on. They remain emotionally volatile and overprotective. The ones that become numb, they are emotionally detached, and they have an intolerance towards weakness in others. The fighters are the ones who always see a need to fight to survive. And those who made it are typically the ones that say, okay, it's easy for us to move on. So the reason I brought up the topic of transgenerational trauma is because there's always a message that is passed down from generation to generation. And it's typically based off of which style of adaptation that each one of these survivors do. So there's something called reparative adaptational impact. And this is when the message is being passed down from one generation to the other, and the children now becomes overprotective of parents. So it sort of creates a dynamics where the parents are sort of overprotective, and it sort of becomes a new trauma towards the parents. And there's the issue of potentially causing more trauma because of this overprotectiveness to others as well. So there's also the cycle of oppressed becoming oppressors and abused becoming abusers. And it's very common with rape victims and domestic abuse that sometimes you see the kid who was abused becoming an abuser in his or her relationship as the time goes on. And then there's the factor of epigenetics. There's genetics do transfer down from one generation to another. And there are genetic codes and SNPs that play a part with abuse and trauma. So Dr. Davis is going to take over here.
Thank you very much. So as we're looking at the categories of trauma, the reactions, the PTSD symptoms, they may be immediate or delayed. And again, when we're looking at post-traumatic stress disorder, just to look at what those words are, the disorder that may come after a post-traumatic stress. So it may or may not interfere with a person's life. Dr. Yanez, when we started, also referred to it as post-traumatic stress. And some people find that's really an important distinction to make, because many of us are traumatized or stressed at different times in our lives, and it may or may not have a tremendous impact. So immediately there may be emotional, physical, cognitive, behavioral, even existential signs or symptoms that we experience. And we may also experience those as delayed. So that inability to deal with things, depression. So they may be right at the moment or show up later and later, such as post-traumatic stress, that these symptoms will come around again. Can you have the next slide, please? And one more, and then back to this, please. Thank you. Thank you. Okay, and then back to that colorful slide. Just to explain to the people on the webinar, I lost my internet today, and so I'm doing this on my phone, kind of with one arm tied behind my back. So my co-presenter is being very accommodating. So there is this continuum model that's really interesting to sort of keep in mind, regardless of whose stress it is or whose PTSD it is, if it's the practitioner or the patient. You know, these are things that we can sort of feel for ourselves what's going on with us, or we can sometimes feel it for ourselves what's going on with the person with whom we're speaking. Just because we have these mirror neurons that may bring a little bit of this alive within us as well when we're talking to somebody. So there's this green zone of sort of ready to face the world, that everything is just fine, we're at our best. Then there is this yellow zone, this reactivity, that it's a reaction to a stressor. And as a reminder, stress is the normal physiologic reaction that occurs when we perceive a threat. So in this yellow zone, we have perceived a threat. Now, it may be a true threat. Lord knows there are lots of those in our environment these days. And we may have seen that in person, heard about it on the radio, seen the film for the 100th time. Or it may also be a memory or an intrusive thought or emotion that's left over from some previous event. So we have this reactive state that may be mild, transient. It's this stress reactivity, you know, of feeling the gut clench, the extremities are ready to move. We can move into the orange zone of there being an injury, that some of these stress reactive signs or symptoms are more severe, they're more persistent. There's a scar, we're at higher risk either for injury or for sensing this again. A lot of times what happens, we perceive a threat, we have this initial stressful reaction, and then we suppress it. So some of the symptoms we may kind of eat, but then we start noticing some of these other features as well. So of the loss of control, panic or rage, substance abuse, trying to avoid those uncomfortable feelings, a diminished sense of purpose. So the symptoms just kind of compound onto the red phase of feeling ill, where the symptoms are continuing to persist. There's an untreated stress injury. So we are caught up in this cycle of reliving and reenacting so often the initial stressful event. Next slide, please. And so with post-traumatic stress disorder, again, if we're looking at this continuum and the diagnosis of PTSD, then there's simple or complex. The simple, there may have been one event or a few similar events. Complex, many events, oftentimes with people who have had a number of adverse childhood experiences, and then they went into another stressful situation. You know, maybe a military who already had adverse childhood experiences, or people on the streets just about anywhere these days, or dealing with the virus. So PTSD, it may be simple or complex. And you can see there are a range of symptoms here. The three sort of key pieces of PTSD are re-experiencing, hypervigilance, and avoidance. The re-experiencing, one tends to have in these thoughts, these images, these intrusive thoughts or emotional states, re-experiencing. The memory comes alive, and it comes alive with all the emotions and physical sensations that were there when it happened. Hypervigilance, being very cautious, trying to usually avoid the triggers that bring that memory to life. And avoidance, avoiding the feelings, avoiding the places, avoiding the sounds, the smells. So these pieces kind of go together, and they just take up more and more space in our inner world with the complexity of the PTSD. Okay. And back to you.
So in our current situation, this is where we're at. We're in the perfect storm for PTSD. This is a COVID-19 that is going around. There was the lockdowns and stay at home, which by itself just brings an added stress to people. Unemployment, job loss, financial crisis, racism, social injustice, inequality, and whatever global conflict and personal conflicts that individuals may have. They all sort of came together, and they've been sort of building on each other, which again brings about the idea of that perfect storm to create for PTSD to occur. So this is going to go back to the stress continuum model. And what I want you to focus on is the bottom part of it, where it says action to take at each phase of the continuum. So again, the goal was to identify where along this continuum that you are, or the person around you are. And these are some of the simple things that you could do to sort of help break yourself from going from one phase into the other. So I'm going to use, for example, from reacting to prevent yourself from going from yellow to orange. Take chance and engage in some type of healthy coping strategies. Identify and minimize the amount of stresses that you have. To prevent yourself from going from orange to red, you might start seeking out help. And then once you're in that red phase, it's where you want to make sure that you have somebody who's properly trained to at least be sort of your guide as what to do from there. So with stress, there's something called, you could do stress first aid, right? There's 5 categories of things that you want to do with stress first aid. Firstly, you want to create a sense of safety for yourself, be it you or the patient. You want to make sure that there's a sense of safety within the room and the environment that the person is in currently. You want to restore calmness. So if you're treating somebody else, you want to at least be calm for yourself, and then you can do the same for others. Self-efficacy, you want to be able to identify that you now feel competent enough to handle that stress. Then you want to establish some type of social support and social connectedness so that you could feel more grounded within that moment. Because a lot of times when there's flashbacks, you could go into that point where it's like you dissociate yourself from where you actually are. So having that social connectedness to where you are is important. And then establishing and sort of creating an experience and hope. Give the person or yourself, talk yourself into some type of hope, or convince that person that is actively experiencing the PTSD, give them hope that things are going to be okay. And in that way, you could actually break it from them actually having a full episode. So back to Dr. Davis.
Thank you very much. So we're looking in this slide at a beautifully comprehensive list of some of the treatment options for PTSD. And again, immediate and long-term options. So breathing exercises, bilateral stimulation, mindfulness, talk therapy, CBT, EFT, craniosacral. These are all things that can be helpful both in immediate and long-term, but especially immediate, because even if you're dealing with long-term, clearly you're looking at other treatment options that would have a deeper impact as well, that are going to be going further down our continuum of therapeutic approaches as a naturopathic physician, and to really have an effect on a lot of the systems that are then being affected by this long-term stress reactive state and the downstream, all of the downstream signs and symptoms that come from that. I want to pause here just for a little bit with sort of the deep breathing exercise, the mindfulness piece of this. This is a big part of what I do in my work. And just to explain very simply, mindfulness is just present moment awareness. I like to think of it as being awareness and acceptance, just paying attention on purpose to the present moment. And the reason that can be helpful with PTSD is, again, the re-experiencing piece of the one of those three legs of the three-legged stool of PTSD, of re-experiencing hypervigilance and avoidance. The re-experiencing, so often what can happen is a person might be a little bit caught up in a memory and quite likely not even know it. I mean, the memories are stored in the midbrain. The midbrain is responsible for determining whether or not we're safe in a situation, and we can override that if we're thinking, but that's not always happening. So with mindful awareness, the invitation is to just be present. And I use often when I'm working with somebody or when I'm working with myself, and if I can tell that I have been triggered or the person I'm speaking with has been triggered, it might be something as simple as just asking them to look around, to look at the colors in the room. Or I'm sitting in a room that has a brick wall. If I was in this room with somebody, I might suggest that they just notice the horizontal lines or the vertical lines in the space around them. Now, if this is somebody who, has OCD and they're into counting, they count things if they're feeling a little stressed, then you wouldn't want to do that maybe, because you don't want them to, get like hooked into counting the bricks or the tiles on the ceiling. But invite them to use their sensory experience. What do you smell? What do you feel? What do you feel beneath your feet? Can you feel the weight of your body in the chair? Can you feel your breath? Deep breathing can be helpful to encourage people to breathe into the belly very slowly, breathing out very slowly. The deep breathing will upregulate the parasympathetic nervous system, which can start to dial down the sympathetic that got fired up with the stress reaction. The out breath also upregulates the parasympathetic. So if the person is with you, if they're breathing with you, or if you are paying attention to your breath because you're the one who's feeling a little chaotic inside, then try breathing in slowly, holding it for a little bit, and breathing out slowly. And try to breathe out longer than you breathe in. If you or the person you're working with is already breathing really quickly, then you might just try breathing out a little bit slower, or you might put the attention someplace else completely. For some people, paying attention to the breath invokes a panic sensation, that they feel like they can't do it right or they're going to stop breathing. So forget that. Ask them to rub their hands together and then feel their hands, feel the heat on the hands, feel the tingling. So just getting back into this moment, and they can then see, and they can look around and see that they're in a relatively safe place. That they can calm down, so they can go back to these pieces of safety, calm, self-efficacy. They can get the sense, I can do this. I was able to do this. If you feel that you need or they need a little bit more touch, bilateral stimulation, you can put your hands on your legs and tap your right leg, then your left leg, then your right leg, then your left leg. Or you can cross your forearms and tap your left leg with your right hand and your right leg with your left hand. And that really, that engages so much more of the brain. It it lets you use a lot of brain real estate. So now you're using the outer part of the brain as well when you're moving, and it's not just limbic system totally in control. Next slide, please. I could keep on going for an hour, so I need to stop out of kindness to everybody else here. So processing PTSD, so working with patients and how to work through that, how to help somebody deal with their own PTSD, to identify potential triggers, knowing, if I hear this particular sound, this particular song, if I smell this is a potential trigger. And identifying early warning signs. If you imagine that slide that went, from green to yellow to orange to red, if it's ours, we've gone through that exchange a few times, and we start to know, oh yeah, when my jaw gets tight or my stomach feels tight like that, I can tell that that's the beginning of a stress reaction. And right there, I can look around and just notice, where am I? What do my hands feel like? What does my breath feel like? Can I be here? So even to bring just a little of the attention into the present moment, into the sensations within the body. So identifying the triggers, noticing when we start to get wound up, and then understanding, having education or providing patients with education so that they can begin to normalize PTSD, understanding their own risk factors, their comorbidities, and learning some techniques. From the last slide, there of any dozen techniques, there may be 3 or 4 that they really gel with, and so helping them with those. Okay, and back to you.
So the next slide talks about how do we process PTSD within the healthcare workers, and how do we prevent it to an extent. So I'm going to start with the first topic of resiliency training. I know with us in the military, and my experience with the military, resiliency training is something that we've been focusing a lot more now on than they have in the past. And this is just from experience of like, what could we do to actually help soldiers who have to go do what they have to do and come back and try to fit back in. So one thing that we do in resiliency training is something called Hunt the Good Stuff. And it's a simple exercise of where you try to identify positive things that has happened to you within a certain time frame. So you could be like, what's something positive that happened today, or something positive that happened for the past week. And it's sort of just to get yourself grounded and focus on positive things that are going on around you, sort of build resiliency through that way. Again, the topic of education is important for healthcare workers as well. Just identifying those risk factors, comorbidities, and techniques that they could use to help for themselves. Another thing, as healthcare workers, what we should be doing is have some type of peer support program. So be it within a single institute, or probably like across a state. So for example, I'm going to use New York State. The NYNP could host a program where it's like, all right, especially during this stressful time now, what are we doing to support each other? And same thing for every state association. So it's just something there that each doctor has a go-to, and you could share your experiences with each other. I know from my personal experiences, when I came back home from deployment and I went for my counseling sessions and stuff like that, it wasn't always easy to talk and open up towards the counselors. But whenever I got together with the guys that went on deployment together, we were easy to bring up topics, and then you see that overlap in things that are happening with each other. So you tend to get a lot of benefits from just having sort of that peer support program. And especially being a healthcare worker and a professional, you're able to sort of help each other figure things out faster, just through your personal training. Another thing that is important is work policies. Establishing some type of debriefing program, especially now where it's a high risk time, where everybody's on edge, everything's going sort of haywire, and you take time out where every individual, every doctor, every healthcare worker takes a time to debrief before they actually leave the job site. And then AR is something that we use in the military, after action review. And basically what you do is you just ask, sort of like review what went on in that specific day or that event that or mission that we had to do. And it's basically what went wrong, what went well, and what could we do to improve for the next time that this goes around. So it's the same concept could be applied to a work policy that allows us to sort of help each other. And then take breaks and take care of yourself while you work. You know how much stress you could take. Don't try to push yourself beyond it. Yes, it's a stressful thing that everything else is going on around you and you need to help people, but you're not going to be able to help somebody if you're not able to help yourself. So just some food for thought there. And back to Dr. Davis.
Thank you. So these are a few sort of quick and easy approaches that you might use, again, for yourself or for the people with whom you're working. And what I was thinking of doing was just taking a few minutes now to experience some of these. And what I would first invite you to do is just sort of let your attention go into your own body and notice what's going on. Notice what's going on in your inner world, the conditions in your mind and body. And the conditions in the mind, it might be busy, it might be quiet, it may be very focused. Conditions in the body, you might feel relaxed, you might not. There might be areas in the body that feel sort of tight, or areas in the body that feel relaxed. So simply noticing that. Again, with mindfulness, it's a combination of awareness and acceptance. Just present moment awareness. What is this moment like? What does it feel like inside? So bringing an awareness and an acceptance to that. It's already like this. I mean, maybe I don't particularly like it. Maybe I have something going on inside that's not comfortable. Well, okay. I mean, I'm not trying to change it right now, just noticing, okay, so that's tight or that's comfy, and being aware, being accepting, saying, okay, this moment is like this, like it or not, and I let it be this way. So with the body scan, we're just letting our attention move through the body. And this is something that, I have CDs that I give out in classes that takes 45 minutes. We can do it in a breath. As you take a breath in, you might imagine that your attention is just moving from your feet up to the head and just noticing sensations in the body. As you breathe out, the attention going the other direction. And just noticing, there may be areas that are tight. There may be areas that even as you notice they're tight, they begin to relax. Especially with the face, you might bring your attention just to the face, the muscles in the face, in the jaw, letting your jaw be relaxed. Letting the muscles around your eyes be as relaxed as possible, letting your hands be relaxed. And then feeling the breath from inside the body. It may be the movement of the air at the nostrils or in the throat, or it may be the movement of the body, the chest or the belly. But just seeing if you can notice that, seeing if you can let your attention rest in the sensations of the breath, not trying to change it. We're not thinking about the breath, we're just feeling it. Just feeling the breath, feeling the body sitting here, feeling the weight of the body in the chair, being kind of aware of the space that you occupy. So bringing awareness into the physical sensations. When we bring awareness inside, into our inner world, typically either we notice physical sensations, or we notice activities in the mind, or we notice emotional states. And here we're sort of focusing on the sensations in the body. What does the body feel like right now? So walking exercise is essentially just the same thing, only walking. So for a walking meditation, oftentimes people are encouraged to find sort of a track that they can take 5 or 10 steps and turn around and take 5 or 10 steps the other way, which may look like pacing, but when you bring awareness to that, the awareness of the feet touching the ground, the awareness of the body moving through time and space, then it becomes a mindfulness practice. It's just like the difference between just breathing and bringing mindful awareness to the breath and trying to feel each breath from beginning to end. One is breathing and one is meditating. It's the same thing. It's just bringing awareness to the movement of the body through time and space. So if I'm particularly wound up and sitting is really not an option, I often find that walking gives me a way to allow my body to settle down, allows my mind to settle down. And, you know, it kind of simulates moving, is moving, simulates running. So the brain, you know, is thinking, oh, good, she got the message, you know, this fight, flight thing going on in me. So she's moving. That's good. I can stand down a little bit. So there's that exercise, you know, for the, for space, we're not going to go through these others. Just quickly, the 3-minute breathing space is inviting yourself or the other person to be aware of everything around them, their environment, what's going on, the chaos or the activities of the mind, the emotional state, all the sensations in the body, then narrow the focus just to the breath for 3 breaths, and then go back to a wider sense of that. Bilateral stimulation, we talked about. Emotional freedom technique is tapping on acupuncture points. So, so those are all very, very helpful. And I have found again that there's something that can be done quick and easy and used either in immediate or delayed sensations. Okay, next slide, please. Resources. Oh, you know, I want to say that these slides were put together, and they are so great that Radley put these slides together, and the resources in these next few slides that he's offered to you are tremendous, you know, well worth the price of admission, I gotta say. So the field guide to self-care, I mean, these are wonderful, immediate and delayed reactions to trauma. So what we're trying to go over and quickly, it goes over here in much greater detail. Great information at the National Center for PTSD through the VA. So especially if you're working with or are a veteran and are interested in some of the resources that are specific to that type of trauma. And there are a couple of books that I have found to be particularly helpful. Full Catastrophe Living by John Kabat-Zinn, and The Body Keeps the Score by Bessel van der Kolk. So both people who work a lot with trauma. And then these apps, the Breathe, Headspace, Insight Timer. These apps are beautiful. So these, again, are great resources. Next slide, please. Risk factors for PTSD. There are a couple of slides here that have these green slides that are kind of like the other slides that go from the green to red. They have so much information. This is a wealth of knowledge. These were slides that were from the presentation that was done for school, and they're just beautiful, and linking the treatment options to the attitudes of mindfulness, or of naturopathic medicine, sorry. Next slide. And resilience. this is, again, it's a great slide that has so much information. We could easily have talked for the entire time just on any one of these slides. And we were saying as we were putting this slide together that one of the things, if we were to try to prevent PTSD, this would be at resiliency, helping people to be resilient, to have the ability to bounce back after they're thrown off track. Tips for working with PTSD. And it's great to keep this in mind, that it's not always straightforward. Not all cases are going to be the same. A lot of people aren't going to come in saying, you know, I have PTSD. Maybe they are, but maybe not. You know, people tend to come in with other complaints, you know, especially if it's been going on for a while. Again, there are all of the other organ systems are involved. Being patient with yourself, being patient with others, having compassion, great compassion, mindfulness and compassion can go a long ways. They're often described as the two wings of wisdom. And having that for ourselves and having that for others, and just having this sense of this connection, that we're kind of all in this together, especially now, and having hope. As you said, many people here who have PTSD are in denial, and that the doctor as teacher can be there to help reduce the stigma, to help them to not feel shame at having a perfectly normal response to trauma. There are so many tools. Again, we've kind of touched on the surface here, but in the slides that we just went through, there's just a wealth of information. And to keep up with the research, noticing what treatments are being used, and being able to share whatever of your own story that you're comfortable with. And next slide.
So when I was in school, I worked with a PTSD patient, and one of the advice that she gave me and really stuck with me ever since, and I share it with all my other PTSD patients, and I'm going to share it with you guys today as well, is that when you tell your story, you could learn more about yourself, and someone will listen and learn from it. And I think this is highly applicable to PTSD and anybody who's experiencing PTSD. And it's not just telling your story in terms of sitting in a counseling session and talking about it, but sharing things that worked for you, sharing your trauma, and telling other people about what you've been through allows other people to realize that there's a lot of overlap when it comes to trauma. There's a lot of overlap that comes from PTSD, and regardless of what the trauma was, the PTSD response and treatments could actually overlap and help each other. So always like leaving this little tip for everyone else. So with everything considered, where we are today, perfect storm for creating that cycle of PTSD and all the social injustices, the racism, and everything else that is going on. How do we move forward? How do we break that cycle? How do we break that transgenerational cycle? So to start with, we have to have those tough conversations, and you have to be open about it. You have to keep an open mind. You have to educate and allow yourself to be educated. If you see somebody doing something wrong, don't be afraid to correct them, especially family members. Sometimes we feel restricted about trying to talk about certain things with family members. And again, at some point in time, we have to break that cycle and avoid actually creating a new cycle. And a lot of it would be done just through the idea of education. Become the change. Start making that difference. I see a lot of people posting on social media and a lot of people commenting when they see something that they don't agree with, especially when they see that injustice being there. So that's part of becoming the change. And as we move up, lift others up with us, not because we benefit from whatever is going on now. And as we move forward, we have to be able to lift others up, and not just within like our community as in like where we lived, or just the community with school. It's everybody. Like the more people you lift up with you as you build up, it's a stronger net that you have when you do fall back, and if you do have a fallback. And lastly, I love politics, and I think politics and policies are one of the most important way to break the cycle. Make your votes count and let your vote be a chance to be a voice. So that's all I have for you guys today. And this is our contact information. And I'll now hand over to Dr. Yanez.
Thank you both so very much. Before we go to a brief question and answer period, I just wanted to update on our upcoming events. So we have career tips and career success next month, July 28th. And then in August, Healthy Skin webinar with Dr. Trevor Cates. And so you can always contact us at info@aanmc.org. That's the next slide, Dr. Ramdhan.
Oh, it's up.
It's up?
Yeah.
The following slide. There you
Okay.
go. And so that's our contact information if we don't get to your question or you have any further ones afterwards. There are a few questions that have come in. The first is just in regards to, when you're looking at somebody who has actively experienced PTSD event, maybe they are in crisis mode. And I know that, there's evidence base that discourages, initiation of trauma, therapy rather, when somebody is actively in crisis. But I'm going to combine two questions together here. How do you not reinitiate, when somebody is going through and telling their story, how do you avoid re-traumatizing them or, any guilt and shame and so on in talking about and going through their story?
So from my perspective, a lot of it, you could go back and apply sort of that stress first aid to the situation. If it does come back up, sometimes you have to sort of process it. But at the same time, it's like you have to establish that safety for that person, sort of bring them back into the room, bring them back to wherever they are. Don't allow them to go beyond what they could tolerate. A lot of people that have PTSD, sometimes they have high tolerance and they're going to try to avoid dealing with certain things. So sometimes you have to get them to that state, but again, you have to have those first aid things right at your hand. Remember, allow them to feel that they're connected to somewhere or to somebody. Give them hope that there's things to move on. And then just creating that sense of calm and safety for them. And then allow them to sort of help them to find where their resiliency is. So that's how I would typically go about with that.
Thank you. And do either of you have resources for veterans who may be triggered a bit more right now with just everything that's going on?
So a lot of the resources for veterans, they could get it on the same link with the PTSD, National Center for PTSD. There's tons of resources on there. Also, the first one that talks about the first resource that we had on here, it actually gives a nice little guide of things that you could do from an emotional standpoint, from a physical standpoint, sort of to help break yourself out of it. It's not always easy to avoid triggers, especially now where every single thing makes it even easier to become a trigger. So figuring out ways to help yourself be more resilient through it. As soon as you feel like you need help, feel free to reach out. Don't wait till it gets to the point beyond control. Remember that everybody has triggers. Everybody has sort of that like first reaction and warning signs. So trying to figure out what your warning signs are, and as soon as you start seeing those come up, deal with it. Be it call a healthcare provider, reach out to the VA. There's hotlines on the website as well that you could call and talk to somebody during that time. So there's I don't know if I completely answered the question for you there.
And if I may, there's also a Veterans Crisis Hotline that, that they can call. And if I can back up to the previous question about how do people not get traumatized, or how can you try to help not traumatize somebody when they're telling the story, that's when I have found for myself that EFT or bilateral stimulation can be very effective. These are ways, again, to either tap on acupuncture points or offering this bilateral stimulation. I will often sit by the person and I will do what I want them to do and encourage them to tap on their chest or the top of their head while they're telling me. And that is a way to sort of make it more tolerable, whatever it is that they're going through in the process of going through the story.
Thank you. There was a question that I actually think is interesting. Both of you have obviously gone through naturopathic medical school, different times, different locations, but in addressing this issue for teaching students, what would you think would be really important for walkaways for ND students to understand and know about trauma and PTSD?
I'm going to let Dr. Davis go first.
Oh, boy, there's so much. I know that the training that I have, I felt I was really prepared for dealing with the downstream signs and symptoms and knowing different therapies that could help with the different physiologic things that were going on from chronic stress. I didn't feel that I had a lot of skills for actually like that first contact or dealing with somebody who's already sort of lost in the woods. And it was when I learned EFT I started at a naturopathic conference and then went from there into training with mindfulness. But it was having a technique, understanding EFT or understanding bilateral stimulation made me feel that I had something to offer if somebody really got triggered, that I would be able to stay there and to help them get back out of it. So I think that some skill like that to really be able to fall back on if the person it goes into it becomes real dissociative, finding skills to help them find their way back.
Thank you.
I agree. A lot of it does actually boil back down to mindfulness and how could you sort of bring yourself and center yourself back to the situation. In terms of things that students themselves could do, it's sort of like the same thing that you could do as a professional healthcare worker, or the slide that I talked about with the professional healthcare workers, in terms of setting up sort of like a peer support group among yourselves. I know class dynamics changes from year to year and people to people, but the class dynamics could play a huge part in actually helping people out of trauma, especially now with things that is going on, and being dependent sort of on staying away from each other. The class dynamics that you have and your ability to interact while you're in school, it does actually translate over to when you become a professional, when you graduate and you leave school. A lot of times they're going to be your first line of people to go to ask for help. What do I do if this comes up, or what do I do if this? Because you learn about each other from school, that each person has sort of a passion for working with a certain field. So just having that support group, I know I went a little bit off beyond what the question is, but having that support group within the class itself, through things like NMSA, setting up sort of programs. And I know like the University of Bridgeport, they were doing sort of like mindful meditation and different types of meditation that they were posting to the group and had students sort of log on and do together as a group. So that's something that they could do, and it could include both professors and students as well.
Thank you. So I have another question, and I know you didn't exactly touch on this, but I'm wondering if either or both of you could speak a little bit to stress and traumatic stress on immune suppression, especially, as it relates right now. If you have any things that you can speak to in regards to the connection between the immune system and stress.
Do you want to go, Dr. Davis?
Well, it's a direct connection. I mean, if a person is stressed, if an animal is stressed, the immune system is suppressed. They need to run away, and instead of fighting off whatever microorganisms they're fighting off. So stress has a big impact. I mean, that's one of the big bad downstream symptoms and signs and sequelae of stress. So just recognizing that. Again, stress is this reaction when we perceive a threat. And so often with chronic stress, it's that very initial moment of perceiving a threat. That's when we take the ticket, for the wild ride. And if we can start noticing what happens when I perceive a threat, what tightens up first, and becoming more aware of that so that we can dial ourselves back to notice, when we got that, when we can start to do the breathing or the walking or the tapping to just try to walk ourselves back from the precipice. And there is so much in the naturopathic armamentarium for dealing with the immune system. So we have a lot of skills for that, and those are, I think that's much of that is dealing with the symptoms, and we have to. But the more that we can also address the cause, which is that perception of perception, and to see if we can just catch it earlier and earlier, and it's kind of like resiliency is how to prevent PTSD. Resiliency knowledge is how to help prevent the immune responses. But then again, there are so many things that we have at our disposal to strengthen an immune system that's getting battered around a little bit by stress responses.
Yeah, I agree. Especially now with everything that is going on, all the stress, it actually could increase the risk of somebody contracting COVID-19 or even being able to, I guess, to have worsened symptoms from it. Because when you put that extra stress onto your system, now it's sort of like overreacting to everything. And it's like, I need to survive and I have to do what I need to survive. And that's what happens when you get into that fight or flight response. So there are cases where it actually completely shuts down the immune system, or sometimes it might actually do the complete opposite, and now every single thing's responding. So there's both sides to it. And again, the key to it is sort of blocking that stress, and how do you perceive that stress, and how do you allow your body to respond to it? How do you internalize that stress?
And one of the first studies that was done on mindfulness and published in a peer-reviewed journal was to show that the immune response was far greater in people who had a mindfulness practice of, I think, like 2 minutes every other day, that their response to a bit of an introduction to a bug was much more robust.
Thank you so much. So we're almost out of time. We do have some questions that are still lingering. So if you do have questions for us, feel free to email us after this webinar. We'll try and work with you to get your response. As you kind of wrap up here, maybe if you could help us, I think practitioners right now, patients, folks are under excessive stress. maybe not everybody, but I definitely hear from a lot of colleagues that this is a time unlike any other they've experienced. And so can you maybe leave us with some words for practitioners on how they can be mindful and grounded and recognize their own triggers as things are going on? And I know we all have these tools, but sometimes we all need a reminder. And so I'm wondering if you can leave us maybe with a little bit for practitioners and how we can be strong and centered and grounded so that we can in turn help others.
Well,
Dr.
I
Davis?
think that a couple of easy things, and that would be, I guess, one of the main things, is to make it easy, make it something that can become a little bit habitual. So if you're going from one patient to the next or one room to the next, just pause. Pause in the doorway, or pause when your hand is on the door handle, pause when you're washing your hands, and notice your breath. Notice what your body feels like. Take just an instant to come back into this moment so that you can become a little bit centered, find yourself again before going on to the next one. And even though, I mean, it looks like, you know, a tsunami when I see some of the pictures, to even just for a breath, just for half a breath, you know, to bring that kindness to yourself that you're giving to others, because we have, our cup has to be full in order to give it to others, or at least it has to have a little bit in it. Maybe in some of these times it can't always be full, but to have something in there.
So
Well, thank you.
my
Oh, go ahead, Dr. Ramdhan.
my advice would be take time out for yourself. Do something that you really love. I know for me, I love writing and I love listening to music. So those are the two things that I sort of use in between. And writing doesn't necessarily have to go into an extensive piece. It's just take a little bit of time and just write down how you feel. Allow yourself to process that information. And music, you could pick one sound that whenever you listen to it, you always feel relaxed. I'm going to tell you the song that I use. It's called Chant of the Islands by Fiji. That's the song I use. That's my go-to song. It's free for anybody else that wants to use it. But that's sort of my go-to song when I need to get that relaxation.
Well, thank you both. We're right at the hour. I appreciate everyone who's taken time to come today. We're going to wrap up the webinar now, but we will have the recording available for folks tomorrow. And I very much appreciate you taking time out of your evenings, Dr. Davis and Dr. Ramdhan, to share your knowledge with us. And for those of you who attended the webinar, thank you for joining. And hopefully we'll see you at another event soon. Take care of yourselves and take care of others. Bye-bye.
Thank you. Thank you for your time. Thank you, Dr. Ramdhan. It was great.
Thank you to you guys as well.
Have a great evening. Good night.
Good night.
Good night. Thanks.